This is Ellis Tackett and my assistant Erica Pitt, and we're talking about pre-health screening and the risk stratification. The purpose of this testing is to assess any kind of factors that may put you at risk before participating in physical activity. Do you have any questions before you take the screening?
No.
Okay, good. Go ahead and just complete this questionnaire here. Now that you completed the questionnaire, do you have any questions?
No.
No. And I see here you don't really have any predisposed factors, no heart attack or heart disease or anything like that? Okay, perfect. Next, I'll calculate your BMI using your weight of 110 or 50 kilograms divided by your height of 5'5" or 3.3 meters squared to equal a BMI of 15. For women, this puts you in an elevated risk and underweight category. That's being on the lower end of the BMI scale. So then, taking a look at your health assessment, which only has one positive, when you marked you don't know your cholesterol level, so you might want to figure that out. But with only having one positive and your BMI results, this puts you at a very low risk category for cardiovascular disease. And I believe after like a successful fitness test that you would be able to start moderate to vigorous activity.
Great.
This is Ellis Tackett and Erica Pitt, and we're doing blood pressure and pulse rate. Patient has been seated for 5 minutes, back against the chair, feet flat on the floor, and she has not smoked or drank any caffeine in the last 30 minutes. When taking blood pressure, make sure to wrap the cuff tightly around the arm, right at heart level, and align the cuff with the brachial artery. Place the stethoscope against the antecubital space. Make sure to use 2 fingers when taking blood pressure, because if you use your thumb, you'll hear your own pulse and not their pulse. Quickly inflate the cuffs to above 22 millimeters and somewhere to a range of 160 to 180 millimeters, and then slowly release the pressure at a rate of 2 to 5 millimeters. Systolic blood pressure will be the point where you hear your first 2 sounds or beats, and then your diastolic blood pressure will be the point where these beats disappear. You'll hear the last beat. At least 2 measurements should be taken at a minimum of 1 minute apart, and the average should be taken of these 2. And then if you're doing this for a first time exam, it should be taken in both arms, and the higher blood pressure should be taken in either one of those arms. So I'll go ahead and take her blood pressure now. When placing your stethoscope ears in, make sure they're pointed out. Then, as I said before, wrap the cuff around. Make sure to align with the brachial artery there. Make sure all your tubing is straight. The cuff is nice and snug and tight. Right in the antecubital space, aligned with the brachial artery. And then begin to pump. And then slowly start to release. Okay, 110 over 78. Let me write that down. Next, we'll check the pulse rate. So when I'm checking pulse rate on the radial pulse, I like to go about a finger's width below the start of the thumb there, and just find a nice steady pulse. and then you'll hold this for a minute and count each beat. No, we're also doing this during volleyball practice, so. All right, so that was about 76 beats per minute there. So we have a blood pressure of 110/78, which is a really great range. The average, I believe, is still, most people still are running with 120/80. So it's a little low on your systolic side. And then your pulse rate is great as well though too. So if you was wanting to adjust or do anything with your diet, you might need more salt or more hearty meats in your diet. That would be my recommendation. All right, so first we'll start with the abdomen. This is taken at the height of the iliac crest here, right level with the belly button usually. So we'll take the first measurement, and that measurement is right at 74.5. Okay, and you always take two measurements, and they have to be within 5 millimeters of each other. Or you have to take a third measurement and do an average until you can get within 5 millimeters of each other. So the second measurement around is that measurement again is right at a little over 74.5. Alright, so the next measurement we'll do is the arm, and this measurement is taken between the olecranon process and the acromion process. The acromion process and olecranon process. So the halfway point for that, 32 there, so the halfway point for that is 18. So we'll take that right there. So that the first measurement is 26. And whenever taking these measurements, you want to make sure not to pull too hard and compress the skin. Alright, and then the second measurement is 26 again on the arm. Alright, now time for the buttocks and hip measurements. Okay, can I do this measurement? You feel comfortable with that? Okay, perfect. So what you'll do is start here on the hip and go around. And that first measurement is a little over 95 millimeters. Just shy of 95 and a half. And then take. So next we'll do the calf. This is the part between the knee and the ankle, the medial part of the calf. So that first measurement here is 32 and a half. Alright, then we'll take that measurement again. And that measurement there is 30 at 33 this time. We'll do our second measurement. This measurement is right at 23 this time. Alright, next is the hip and thigh measurement. This measurement is taken right below the gluteal fold. Do you feel comfortable with this test? Okay. So right below the fold there, taking this measurement at right at 54 millimeters. And then second measurement is right at 53 and a half. Alright, next is the mid-thigh measurement. This measurement is done with the client flexed at 90 degrees. And this is a measurement taken halfway between the inguinal crease and the proximal border of the patella. So this measurement is right at 40, so halfway is 20, or halfway point there. So the mid-thigh measures that 45 millimeters for the first measurement. Then the second measurement is again 45 millimeters. And then our last measurement is the waist measurement. This is done above the umbilicus and usually right below the xiphoid process. So above the umbilicus, belly button here, and then the xiphoid process is that little sharp tip at the bottom. And our halfway point there. That measurement is at 67 and a half. And then our second measurement is at, this measurement this time is at 68. Looking back at the waist to hip ratio, with your waist average of 67 3/4 and divided by your buttock and hip average of 94, that brings you in 71, and that puts you in a low risk category for any kind of health problems. So
Awesome.
yeah, that's it. Ellis Sackett and Erica Pitt doing skin fold measurements. We do skin fold measurement to at different sites to take any kind of body fat percentage in an equation and puts you at risk for cardiovascular disease or any kind of other health related problems. Okay. During this filming, if you have any kind of worries or anything, feel uncomfortable with any sites or anything, just let me know and I'll ask you if you have any problems or anything. Okay.
Okay.
Measurement will be the abdominal measurement. Do you feel comfortable with this?
Yes.
All right, perfect. So you take this at a vertical fold, 2 centimeters to the right of the umbilicus. So we'll pinch in and take the first measurement at, that's at 31 millimeters. Let me record that. All right, and then we'll take our second measurement. And that is at 29 millimeters. Next measurement will be at the tricep. This measurement is a vertical fold halfway between the acromion and the Lecanron process. That measurement is at 24 millimeters. Record that. And then we'll take the second measurement. And that measurement is at 25 millimeters. This measurement is the bicep. This is a vertical fold. 1 centimeter usually above where the tricep measurement was taken and in the belly of the bicep muscle. That measurement is at 10 millimeters. Retake that. You always want to retake measurements 2 times and then get the average of that measurement within 1 to 2 millimeters of each other. That measurement is at 10 millimeters. This is the chest / pec. This is a diagonal fold, and it's a distance of 1/3 between the axillary line and the nipple in women. Do you feel comfortable with this? Okay. So, diagonal fold, and then your measurement. 5 millimeters. Let me record that. And diagonal fold again. And the reading again is 5 millimeters. This is the medial calf measurement. This is taken at the largest circumference of the calf muscle. Measurement of 31. Record that. And second measurement is at 26. So we'll take a third measurement. So for the third measurement on the calf, and that is right at 31. Perfect. The mid-axillary measurement, this is taken right at the level of the xiphoid process in the sternum. Are you okay with this measurement?
Yeah.
So we'll push in. And then take our caliper and get a measurement of 10 millimeters. Do that same thing again. And a measurement of 10 millimeters again. This is the subscapular. This is a diagonal fold, taken 1 to 2 centimeters below the inferior angle of the scapula. That measurement is 16 millimeters. And our second measurement is right at 14 millimeters. The super iliac crest measurement, do you feel comfortable with this measurement?
Yes.
So this is a measurement taken superior to the iliac crest, a diagonal fold. That measurement is right at 14 millimeters. So then we'll take the next skin fold measurement. Second measurement is diagonal fold again, and that is at 12 millimeters. The last measurement is the thigh measurement. This is done midway between the inguinal crease and the patella. That first measurement is right at 31 millimeters. And then our second measurement we'll take is right at 31 millimeters. That up to better your category rating, your percentage rating. So increase cardiovascular fitness, increase exercise would be my recommendation.
Okay.
This is Ellis Tackett and Kelsey Joe doing the 1.5 mile test. This test is, the purpose of this test to estimate your cardiorespiratory fitness level and your VO2 max. It's important to keep a good steady pace while you do this distance and do it in the short amount of time possible.
Okay.
Do you understand?
Yep.
All right, perfect. Great job. Keeps a nice steady pace. All right, coming around, about to finish up her fourth. All right, Kelsey's coming into her final lap here. Still keeping a pretty great pace. Give it a good pace, Kelsey. Come on, one more lap to go. Good pace. Counting down from 20 as she comes across the line here. She'll be hitting a pace of right at 12 minutes and 58 seconds. Great job, Kelsey. Alright, so Kelsey Joe just finished the 1.5 mile run, walk. She had a great pace, and when compared to the percentile for women ages 20 to 29, her time closest to, for the 1.5 mile run, her time closest to 12:53, her time was 12:58. That puts her in the 65 percentile in a great, or in the good category. So, being in the 65 percentile, if you wanted to stay around there, you just maintain your current fitness level. But if you were to want to increase your fitness in any way and possibly move up to another weight class, as you know, as a college athlete, more conditioning, farther timed runs. How many times a week do you work out?
Like 5 or 6.
Five or six? How many minutes a day?
Like 30.
30 minutes a day? So always try to push yourself, continue to up your weight whenever you lift, try to increase your cardiovascular fitness to try to increase that time mile run. Okay?
Okay.
And next is the step test. We do the step test to test aerobic health. So it's a 3-minute test, and then after the 3-minute test, I'll immediately take your heart rate, and then we'll compare that heart rate to an aerobic scale. So all you do is you'll follow the beat that I'll have, the metronome. It'll be a 24 step per minute test, and then all you do is just step up, follow the beat, then step back down. Just make sure to stay on the beat with the beat. Okay? That sound good? Thanks.
Sounds good.
Alright, this is Erica Pitt doing the step test for 3 minutes. She will stay at the constant beat of the metronome at a speed of 96. Keep them a good, solid pace. Don't get too fast and don't get too slow. Doing this on a 12-inch bench. Keep a good pace, doing a good job. Great job. Stay with the metronome. All right, 1 minute in, 2 minutes to go. And then when Erica completes this, when the 3 minutes are up, I will check her brachial pulse for 1 minute and see what her heart rate is after 3 minutes. Great job. All right, 2 minutes in, 1 minute to go. Doing great. In the nose, out the mouth. Great job. So as the time winds down here with 30 seconds to go, I'll start to attempt to check Erica's pulse within the last 5 seconds here. 15 seconds. 5 seconds. All right, complete. Have a seat. And then we'll just check this for a minute. Heart rate of 116. So, taking a look at your heart rate now on our aerobic classification scale. Under women, for under 36, you had a heart rate of 116. So the average heart rate for this test is 118. So I think a pretty good level to be right at average. Above average is 109. So if you're wanting to set any kind of goals, increase your aerobic activity, but otherwise just continue to maintain what you're doing to stay right at that average level. Everything seems real good.